Hello, this is Group1L. In this presentation, we'll be presenting an analysis on the healthcare system of Singapore. Singapore's healthcare system is often recognized as a global benchmark for its efficiency, high-quality outcomes, and cost-effectiveness. Achieving universal health coverage through a mixed financing system, it emphasizes individual responsibility and government support. This presentation will examine the contextual factors influencing the system, its structural organization, financing models, and also service delivery approaches. We'll also provide targeted recommendations to address critical challenges. In the first part, I'll explain the 8 key contextual factors impacting Singapore's healthcare system and their positions on the chart. First, demographics. Singapore faces rapid aging, putting pressure on healthcare resources and caregiving. Foreign workers, especially domestic helpers, are crucial for supporting the elderly. Due to its long-term impact, demographics is in the top right, indicating high impact and long-time horizon. Second, epidemiological factors. Chronic diseases like diabetes and hypertension, driven by aging and unhealthy lifestyles, and infectious disease like COVID-19 and dengue are challenges. Its high impact and medium to long-term relevance place it slightly below demographics. Third, political factors. Singapore's centralized political system and the Ministry of Health's primary role in healthcare policy result in stable healthcare. So, political factors are limiting influences. Its current relevance places it in the bottom left, reflecting lower impact and short-term horizon. Fourth, legal and regulatory factors. Singapore's legal framework ensures equitable healthcare through policies like MediSafe and MediShield Life. Its short-term focus and moderate impact place legal and regulatory factors in the bottom left. Fifth, economic factors. Healthcare expenditure in Singapore has steadily increased from 3.34% to 5.57% of GDP between 2000 and 2021. If this trend continues, it could threaten healthcare sustainability with notable impact and midterm relevance. Economic factors are in the middle right. 6. Socio-cultural factors. Family-centered elder care is a norm in Singapore's multicultural society, shaping healthcare services and policy. With moderate impact, is centrally placed on the chart. 7. Ecologic factors. Climate change and urbanization pose long-term risks, including heat-related illnesses and vector-borne disease. With low short-term impact but long-term relevance, ecologic factors are in the top left. Finally, technological factors. Advances like the National Electronic Health Record System improve efficiency, but raise concerns about data privacy. Due to its transformative potential, technology is ranked high in impact but lower in the time horizon compared to demographics.
Moving on, let's discuss the goals and objectives of Singapore's healthcare system. Firstly, Singapore aims to develop a healthy population by emphasizing preventive care and promoting healthy lifestyles. Secondly, it seeks to enhance individual responsibility for healthcare through the 3M system, encouraging citizens to save for medical expenses. Moreover, it focuses on maintaining low healthcare costs by regulating healthcare supply and ensuring efficiency in resource use. Singapore's healthcare system is a global leader in terms of performance. As demonstrated in Table 1, it achieves relatively high life expectancy rates in both females and males, health life expectancy at birth, and life expectancy rate at age 60. Besides, strong public satisfaction is possessed. However, its relatively high healthcare outcomes are associated with lowest and less than half the health expenditure per capita compared to countries like Japan, US, and the UK. While out-of-pocket healthcare expenditure is relatively high, the system delivers excellent outcomes at a fraction of the cost seen in comparable nations. The Singaporean healthcare system can be defined as highly centralized in comparison to other countries. However, decentralization exists in several areas to better achieve local needs. On the one hand, the Ministry of Health is the core coordinator of the system, where laws, regulations and policies are formulated and regulated at the central level to ensure uniformity and strong governance. On the other hand, many tasks are decentralized to enhance adaptability and efficiency. Firstly, the 3M framework empowers individuals to manage health expenses, thus achieving financial sustainability. Besides, hospitals and clinics get some managerial freedom as well, thereby adjusting to local necessities. Moreover, service delivery is the most decentralized function, as RHS provides care delivery regionally to address local needs effectively. Next, the revenue collection is centralized due to taxation and compulsory contributions, such as Medisafe, and thus follows a slab model. Besides, fund pooling is carried out by different entities like the 3M framework, which allows a chunky model. Moreover, purchasing follows the chunky and mosaic model due to its regional sources control but competition in the private sector. Lastly, service provision follows a mosaic structure as it relies on the RHS for service distribution across different regions, but also integrates care across different healthcare providers such as public hospitals and clinics.
Moving on, Singapore's healthcare system is unique due to its geographical size. As an island city, the only area in Singapore where resources are strategically allocated is the funds associated with each subsidy. The government evaluates four main parameters to determine funding for each subsidy: age, income, population size, and prevalence of chronic diseases. However, information on these parameters remains inaccessible to the public, and failure to consider additional parameters like mental health and preventative care, such as education levels, may result in potential inequities in the healthcare system. Singapore's SGDRG system encourages hospitals to adopt cost-effective procedures by allowing them to retain surpluses. Rates are reviewed annually based on case mixes, ensuring fair reimbursements and reducing opportunities for gaming the system. To counter risks of low-quality care or excessive patient volume, the government introduced a pay-for-performance scheme rewarding quality care. However, this scheme is still in its integration stages, with accurate performance evaluation posing resource challenges. Despite efforts to balance efficiency and quality, pitfalls remain, as providers may exploit the SGDRG system due to its current limitations. Private primary care providers in Singapore operate under a fee-for-service model, encouraging competition whilst risking overtreatment for profit. To address this, a capitation model introduced in 2023 allocates funds based on population size, promoting preventive care and tackling non-communicable diseases. While this transition aims for efficiency, challenges include potential reduced motivation for quality care, fewer patient visits, and insufficient funding to cover demographic needs, highlighting the model's current limitations during its implementation phase. Singapore's healthcare financing model is a hybrid multi-payer framework designed to ensure responsible resource use and affordability. It is categorized into 4 tiers, each with different levels of progressivity. Firstly, government subsidies cover up to 80% of medical expenses. Funded through taxes, these subsidies represent approximately 50% of total healthcare expenditures, making this tier highly progressive and ensuring affordability for residents. Secondly, Medisafe requires contributions of 8 to 10.5% of income, mainly for primary care. While it promotes personal accountability, it is slightly regressive due to a salary ceiling of $6,000, which disproportionately affects low-income individuals. Thirdly, MediShield Life covers large healthcare bills for secondary and tertiary care. Premiums are paid through Medisafe, and risk pooling is managed nationally by the Central Provident Fund. Subsidies are available for low-income individuals, making MediShield Life a progressive tier that ensures equal access and affordability. Finally, MediFund serves as a safety net for low-income individuals who have exhausted Medisafe and MediShield Life. Funded through taxes and reinvestments, MediFund is a progressive, reinforcing affordability for the most vulnerable populations. Together, the 3M framework accounts for approximately 30% of healthcare expenditures. The sustainable and fair financing framework not only pools sustainable risks and funds on a national scale, but also balances individual contributions with government support. Subsidies, accounting for 50%, ensure fairness as they are funded through income-based taxes. However, it is noted that Singapore still has a high out-of-pocket payment around 20%, and this can be attributed to the high-income nature of Singapore and the purchasing power for higher quality care.
Next, we will cover 6 key factors to analyze the health service delivery in Singapore. Firstly, Singapore's healthcare system integrates Medisub and Medishield Life, promoting shared responsibility for healthcare costs while easing financial burdens, especially for hospital bills and outpatient treatments. Secondly, a strict hierarchical treatment system directs patients to appropriate care levels, reducing hospital congestion, lowering long-term costs, and improving resource efficiency through preventive services. Thirdly, the electronic health record system has been adopted to enable national sharing of medical information, ensuring the seamless coordination among healthcare providers. Digital platforms further enhance accessibility by offering appointment bookings, health information queries, and online counseling services. Moreover, primary care uses a dual-track service delivery model, where 80% is provided by widely distributed private clinics, which are convenient and efficient. 20% are covered by government-run polyclinics, which focus on serving low-income groups. Additionally, Singapore is among the healthiest nations. Singaporeans live an average of 84 years. 73.9 of which are healthy. It has a low infant mortality rate of 2.2 per 1,000 live births, surpassing the OECD average of 4.2 and over 95% vaccination coverage. Furthermore, Singapore ensures universal coverage through mandatory health insurance for all legal residents, including citizens and permanent residents. To address the challenges of Singapore's healthcare system, particularly with an aging population and rising healthcare demands, we propose the following recommendations. Firstly, as the aging population keeps increasing, it could be addressed by increasing investment in communities and home care facilities to decrease the dependence on hospitals. Moreover, healthy aging would be promoted through programs focused on elderly preventive care or incentives, offering reduced fees or taxes for healthy activities. Secondly, Singapore's out-of-pocket healthcare expenses exceed the international average. Reforming Mediself to cover more long-term outpatient care and providing additional savings support for low-income earners can help. Government funding should aim to gradually lower out-of-pocket payments to the OECD average of 20%. Besides, the rising ND burden and aging population strain primary healthcare with under-resourced GP clinics and overburdened public polyclinics. Supporting private GP clinics with upgraded equipment, manpower training, and resource sharing can improve their capacity to manage complex cases. Establishing regional polyclinics that cluster private clinics with shared resources can enhance efficiency in primary care. Moreover, lower income groups and the elderly face significant barriers to healthcare access. Targeted subsidies through Medifund and Mediself can reduce financial burdens. Partnerships with NGOs and private clinics can expand subsidized services in underserved areas, ensuring accessible care for disadvantaged groups.